Hello, everybody. I am Mehmet Duray from Süleyman Demirel University. I am one of the member of the project that clinical care for electrical stimulation in physiotherapy and rehabilitation. Our project was co-funded by Erasmus Plus program of the European Union. Our project coordinator is Pamukkale University and other project partners are University of Craiova, Hatay Mustafa Kemal University, Başkent University, Süleyman Demirel University, Şule State University of Applied Science, Burdur Mehmet Akif Ersoy University, and we have some association partners that are Turkish, Romanian, Lithuanian, and Estonian Association of Physiotherapists. I will make a presentation about high voltage pulse galvanic stimulation and its use in rehabilitation under Model 2, currents used for electrical stimulation. In 19th, high voltage currents began for the control of pain and edema, especially for the pain control. And in 1945, high voltage pulse galvanic stimulation was developed with the name Dimeware. After 21 years, high voltage pulse galvanic stimulation is spatially began to use and after 1970 high voltage pulse galvanic stimulation was started to use popularly in rehabilitation. As we discuss about the difference between low voltage and high voltage currents. Low voltage currents are the current under 150 volt power, and high voltage currents are above the 100 has above the 150 volt power, and high voltage pulse galvanic stimulation has a power between 150 and 500. Low voltage currents pass into deep tissues difficultly, but high voltage currents has easily passing without causing discomfort to the patient. And in low voltage currents, long pulse duration durations are needed to provide stimulation, but in high voltage currents, moderate muscle contractions due to the short duration of the phase with the minimize the feeling of discomfort. Low voltage current increase circulation in skin and contractile structures greater than high voltage currents. High voltage pulse galvanic stimulation is used to increase circulation and venous return by stimulating sympathetic activation and pumping effect with contraction facilitation. High voltage pulse galvanic stimulation is especially applied at 300 and 500 volts, and the current has twin peak pulses, as you've seen in the figure 1. This is the first peak, and this is the second peak pulses. This pulses has very short duration of 7 and 200 microseconds, and the current has an average of 100 microseconds stimulation time, as you can see in the figure 1. The twin peak pulses has the 100 microsecond stimulation time. And the current has a huge resting time compared to stimulation time. The resting time is 9,900 microseconds, as you can see. And a monophasic twin peak pulse is formed in the form of a pointed spike like this, and the current intensity rises rapidly and falls rapidly too. The second beat after the first beat prevents, this is the first beat and this is the second beat. Second beat prevents the irritation of the first spike with a frequency of 1 to 100 beats seconds. High voltage pulse galvanic stimulation crosses the skin very quickly. This is a very important effect and encounter lower skin resistance due to it is high frequency. Uh, these attributes makes high voltage pulse galvanic stimulation an easily tolerable and highly effective agent. And the current to the continuous modulation is often pulsed 80, 100 times and could be searched according to the preference. The high voltage pulse galvanic stimulation stimulates especially motor and sensor nerves and deep tissues. The frequency of current preferably could be increased or decreased. You can choose positive or negative pole excitation. The application can be monopolar or bipolar, and the treatment time is between 30 and 60 minutes. You can use high voltage pulse galvanic stimulation between 3 and 7 days in a week. High voltage pulse galvanic stimulation stimulates deep tissues. We talk about this high voltage pulse galvanic stimulation past the tissue from tissues easily, and the current contribute to modulation of pain and healing of wounds, and the current contains high intensity short pulses that stimulate the motor nerves for the sensory nerves. Uh, High voltage pulse galvanic stimulation provides motor stimulation which allows selective stimulation of muscle fibers. As a result, high voltage pulse galvanic stimulation provides neuromuscular stimulation is a optimal neuromuscular stimulation by reversing the atrophy mechanism, increasing enzymatic activity, providing isolated muscle contraction, and preventing muscle atrophy. The short pulse duration of the high voltage pulse galvanic stimulation result in selective sensory and motor stimulation, but a photoreceptor stimulation. We said that the current passes the easily and quickly from skin, and the current reaches to deep nerve and muscle tissues, ensuring the continuity of tissue regeneration. In the treatment of pressure source, the current prevents the proliferation of microorganisms with cathode stimulation, and it accelerated the regeneration of the wound uh, by creating a galvanotoxic effect with anode stimulation. Uh, in the application of high voltage pulse galvanic stimulation, healing is not only in dermal area but also in subdermal area. Stimulation, DNA, and protein synthesis in fibroblasts are seen in the application. And it is reported that after and during high voltage pulse galvanic stimulation, the stimulation, the autonomic nerves and smooth muscles of the vasomotor structures are seen, and the current is effective in relieving neurologic pain with a combined effect of one, blocking pain pathways after nerve stimulation. Second, relieving deep muscle spasm by stimulating trigger points. And third, increasing post-feeding wound healing. In the providing of pain management, the current stimulate of release and synthesis of opiate substance, enkephalin and endorphin in the central area, and the current create a more intense stimulus than pain at the motor point of the muscle or the acupuncture point. The uh, the current cause to diffusion of non-painful stimulatory areas of painful sensory fiber activation, and in the application by increasing the electrode size you can achieve more effective painless sensory fiber stimulation. If we talk about the spatial uses of high voltage pulse galvanic stimulation, we can achieve effective muscle contraction with the current, and we can increase muscle strength up to the functional level. You can use high voltage pulse galvanic stimulation for increasing and regulation of circulation. It is used for reducing pain and edema, acceleration of wound healing, and spatially preventing secondary complications. You can use high voltage pulse galvanic stimulation in muscular dystrophies, but we know that electrotherapy could be used or not in patients with muscular dystrophy is not obvious. But in the studies, it is reported that high voltage pulse galvanic stimulation increased the strength of proximal muscles and participation to the daily living activities. And when we consider the need for patients with muscular dystrophies, high voltage high voltage pulse galvanic stimulation could increase muscle strength without causing pain and fatigue. We can use high voltage pulse galvanic stimulation in athletes and treatment in immobile patients. In athletes, the current has similar neuromuscular effects to the rushing current, and it is recommended to be used in combination with exercise for the greater effectiveness on the muscle strength and endurance. In immobile patients, the high voltage pulse galvanic stimulation prevents the pressure source because of immobility, especially in patients with neurological diseases. And the high voltage pulse galvanic stimulation has a protective role because the current increases blood supply, collagen synthesis, and fibroblast activation. So the current facilitates wound healing. In constipation, high voltage pulse galvanic stimulation leads to stimulation of neuroendocrine nerves and increased intestinal motility. After high voltage pulse galvanic stimulation, it is occurred an increase in intra-abdominal pressure, increase in painless bowel movements, decrease in rectal bleeding, edema, and burning symptoms. And high voltage pulse galvanic stimulation leads to decreased pelvic floor dyssynergy, increased pelvic floor muscle strength and functions. We can use high voltage pulse galvanic stimulation in muscle training after orthopedic or neurological pathologies. Muscle training, how high voltage pulse galvanic stimulation can be applied with bipolar technique and by making the current surge or intermittent. The current can be applied, we said that by making it surge or intermittent, improves head control in patients with diplegic cerebral palsy. It was reported, and the current increases the strength of lower extremity muscles and decrease fatigue in patients with multiple sclerosis. High voltage pulse galvanic stimulation is used for muscle spasm. You can see in figure 2 and wound healing in figure 3. You can see the for muscle spasm and trigger point pain, the accepted electrode placement and treatment protocol is the same as for low frequency applications, and standard rubber electrodes are used for wound healing. Uh, in use for wound healing, the wound area should be cleaned. It is very important, and the wound should be debrided and covered with sterile gas. The electrode size are routine 4 and 4 or 5 and 5. You can use monopolar or bipolar technique. The passive electrode should be 3 times the surface area of the active electrode, and the passive electrode should be placed more proximally of active electrode. The current intensity should be increased to a tolerable limit gradually. It is very important, not sudden increase. The duration time for treatment for application is between 30 and 60 minutes. High voltage pulse galvanic stimulation specifically stimulates the sensorial and motor nerve fibers. It allows rapid muscle reduction, re-education, and atrophy rehabilitation. High voltage pulse galvanic stimulation may cause early fatigue in case of muscle weakness and atrophy. The current is preferred to be applied at least 5 days a week for wound healing, and the current should be applied at least 3 days in a week in the treatment for muscle spasm and strength. In terms of advantages of high voltage pulse galvanic stimulation, we see that the current allows for painless selective sensory fiber stimulation. Since the skin resistance is low during the application, deep tissues and nerves are easily stimulated. The high voltage pulse galvanic stimulation can be used for different purposes, from wound healing to muscle contraction. A lot of current can be used for a wide range purposes. And high voltage pulse galvanic stimulation increases joint mobility by reducing pain and edema, increasing microcirculation and mechanical strengthening. High voltage pulse galvanic stimulation doesn't produce contraction very strong, as strong as neuromuscular electrical stimulation. When more increased strength is desired. However, compared to low voltage and long pulse duration agents, the tolerable short pulse duration reduces chemical and health-related side effects, and the suitable the current is a suitable agent for long-term use. It has not been reported any noticeable side effect profile for the high voltage post galvanic stimulation. Um, the current has some contraindications in the treatment, such as osteomyelitis, cancer, pacemaker use, pregnancy, use of topical substance that can cause wound irritation, tissue toxicity, and or an allergic reaction. Care should be taken not place electrodes on or around the heart, phrenic nerve, carotid sinus, and larynx muscles. Attention should be paid to areas with sensory disorders, tissue that have lost their skin integrity, and if you treat a patient with epilepsy, the patient should be monitored during application. You can look for more information to his references, or you can reach lots of information in my book chapter that is named High Voltage Pulse Galvanic Stimulation. Thank you for your listening, and I want to thank to all project partners. Thank you.